murky with highs in the mid-70s. Clear tonight with a low of 49, and then sunny tomorrow and Thursday with highs in the low 80s. COC presents Mark Nadler at the Pack, Saturday, April 7th. 2 shows, 6 and 8:30 p.m. A 3-time award winner for Outstanding Musical Comedy Performer. He's a singer, dancer, pianist extraordinaire. For more information, go to hometownstation.com.
Good morning, Southern California, your hometown station, KHTS. This is your host, Fred Arnold, on the Southern California Real Estate and Business Show. I'm joined by, I'll say my friend because he's been on several times, Dr. Nimit Sudan from UCLA Health. Welcome back to the show.
Thank you. Thank you for having me again.
Yes, we were just talking about this cold weather, the fact that the flu season's winding down.
Yeah.
That's positive, right? And spring is around the corner.
It is. The rain is gone. The sun is out.
Yeah.
It's turning green.
Yeah, everything's getting beautiful. I want to talk today about, and it's something that's new to me, and luckily so, right? Because if you're sick, you would know it. Integrative medicine or oncology. Did I say that right?
Yes, integrative medicine or integrative oncology specifically pertains to cancer. So what does integrative mean? So, we have Western medicine, what we use every day, chemotherapy, for example, for cancer, surgery, radiation. And then in addition to that, there are other modalities such as, yoga, meditation, herbal supplements, acupuncture, manipulative therapies such as chiropractic care. So, we find that 80 to 90% of cancer patients are actually doing something else in addition to the usual treatments, the usual chemo and surgery and radiation. So it's really interesting. And I think what integrative medicine, integrative oncology is, it's a new, subject, newer, I would say, and I think we in Southern California are leading this because if you go to other parts of the country, it's not as well recognized
or even accepted, maybe.
Even accepted, yeah. The acceptance is coming because there is newer research that's showing that some of these modalities actually do work and they do help. They do supplement the usual care that we provide.
Yeah, a lot of it has to do with the way you interact, the way you feel, the way you're kind of that mind-body experience.
Exactly.
And I think that that's becoming more acceptable because if you just think about your daily life and not being sick, how much more refreshed do you feel when you walk on the beach with your shoes off?
Right.
How much better do you feel when you go to the park and go for a walk midday during a stressful day at the office?
Right. So we found research has shown that modalities such as meditation and yoga. I mean, meditation sounds like a fancy word, but really, at the end of the day, what does it mean? It means take a few minutes to yourself, calm down and just kind of disconnect. And that lowers anxiety, lowers blood pressure, lowers heart rate, which, studies have shown that might lower inflammation and prevent disease.
Yeah.
It's actually pretty amazing.
What kind of conditions can these modalities help with?
So they can address basically anything. I mean, there's little research that shows these modalities will actually treat cancer. So it's not an alternative to standard therapy, but it is what we call a complement to standard therapy. So some of these modalities, so you take acupuncture, for example, has been shown to help in nausea, has been shown to help with pain. If you look at other modalities, which we don't many times consider alternative or complementary, like exercise or nutrition, which it really is.
Doctor, for some people, that should be a way of life.
It should be. But if you look at some of these studies, I mean, they lower the risk of cancer. They lower the risk of cancer, and they lower the risk of cancer coming back in people who've already gone through cancer. So just, eating a more plant-based diet. You don't have to be vegetarian, but more plant-based diet, higher fiber, and being active. And you don't have to run a marathon every day, but 20, 30 minutes a day, several days a week. And, you can lower your risk of cancer.
Yeah, and I think that's so true. What is the research? Is the research turning yet on it specifically, or is it still in the beginning stages?
I think in the big picture we're in beginning phases, but the nice part is we're now beginning to recognize that these modalities are actually helpful, and that we need to do more research. We need to look in depth, or more in depth, in these modalities. So, I think we're still taking baby steps, but I think 10, 20 years from now we'll get there.
Yeah, no doubt. What are the pitfalls?
Well, pitfalls are a lot. So there's a lot of people out there that just want to make a few bucks. So there's a lot of scams out there. But in reality, if you take some of the herbal supplements, there can be interactions with medication, with standard treatment. So you have to watch out for that. So really speak with your physician. There are a lot of studies out there that some of these herbal supplements can cause kidney damage, liver damage. Again, my recommendation is if you're going to do something, make sure you discuss it with your physician. Speak with your doctor.
Yeah, and I would just say is, and I was doing a presentation this past weekend. Start being a kid. Yeah. Start running around. Start laughing. Start smiling. Maybe watch. Binge watch a movie all Saturday afternoon and just relax and download, or take your iPad in the backyard and start being more like a kid, and let the stress of everyday life just slowly melt away if you can.
So if you actually look at centenarians, so what are centenarians? People who make it to 100, who live 100 years old. If you look at what they do throughout their lives, that's one of them. They have a sense of humor. They're active. Active not meaning regular exercise, but they're always out and about and doing something. Right. They stay mentally active.
Yeah, my father said that recently. He goes, I walk, so far, and I'm like thinking to myself, wow, that's pretty impressive. And he showed me his phone because it keeps track of his steps. Yep. But so many ways. So those at UCLA they would like to reach you at UCLA Health on Tournament Road.
Yes, so just go to UCLA website and you can look me up, or any of the UCLA physicians.
Perfect. Dr. Nimit Sudan, thank you for coming in.
Thank you.
My best to your wife and 3 children. Have a wonderful spring, and we'll see you in the summer.
Thank you.
Absolutely. Well, I hope you enjoyed this edition of the Southern California Real Estate and Business Show. This is your host, Fred Arnold, on your hometown station, KHTS.
Tucked away in Canyon Country is an upscale